The SYNCHRONY EAS hearing implant system is designed for individuals with high-frequency hearing loss. Individuals with this type of hearing loss can hear low-pitched sounds, but have difficulty hearing high-pitched sounds, and have difficulty understanding speech in background noise. The SYNCHRONY electric acoustic stimulation system combines electrical stimulation by a cochlear implant with acoustic amplification, enabling recipients to benefit from their residual hearing for a more natural perception of sound. The SYNCHRONY EAS system consists of the externally worn SONNET EAS audio processor and the internal SYNCHRONY cochlear implant. The SONNET EAS audio processor is worn behind the ear with a customized ear mold that is worn in the ear. The SYNCHRONY implant is surgically placed under the skin, and a flexible electrode array is inserted into the cochlea. The cochlea is the part of the inner ear that converts sound waves into nerve signals, which the brain processes as hearing. The apical region of the cochlea is responsible for detecting low-pitched sounds, while the basal region is responsible for detecting high-pitched sounds. The cochlea is lined with thousands of sensory cells, known as hair cells, which detect sound waves and send sound information as nerve signals through the auditory nerve to the brain. For individuals with high-frequency sensory neural hearing loss, many of these hair cells in the cochlea do not function normally and are not able to send these nerve signals properly. An EAS system bypasses these non-functioning hair cells by using a combination of acoustic amplification and electrical pulses to send sound signals to the auditory nerve. To achieve this, the SONNET EAS audio processor detects environmental sounds with its dual microphones and digitally converts them into coded electrical signals. The sound signals are separated into two groups: low-pitched sounds for acoustic amplification and higher-pitched sounds for electrical amplification. Low-pitched sounds are digitally amplified by the audio processor and transmitted to the ear canal through the ear mold in order to take advantage of the recipient's natural residual hearing. For high-pitched sounds, SONNET EAS transmits coded electrical signals through the skin to the implant by a communication coil. The implant translates the coded electrical signals into electrical pulses, which are transmitted along the electrode array to stimulate the regions of the cochlea responsible for high pitches. By mimicking the natural function of the hair cells, these pulses can deliver sound signals directly to the auditory nerve. The auditory nerve simultaneously receives both amplified acoustic and electrical sound information. These signals are then transmitted by the auditory nerve to the brain, where they are interpreted as sound. By combining electric and acoustic stimulation, the advanced technology of the SYNCHRONY EAS system enables our recipients with high-frequency hearing loss to make the most of their natural hearing.